Hi everyone, my name is Saisha Pal and I'm an AIM Youth Ambassador, and I'm so excited to kick off this AIM interview series with an AIM Scientific Advisory Board member and implementation science expert from Northwestern University, Dr. Rinad Beidas. Welcome, Dr. Beidas, and thank you so much for being here. Could you start by quickly introducing yourself?
Absolutely. Hi, everyone. My name is Rinad Beidas. I'm professor and chair of the Department of Medical Social Sciences at Northwestern University, Feinberg School of Medicine, and a proud scientific advisory board member.
Nice to meet you, and we're so excited to have you here. So, the first question we want to ask you is, why is mental health important to you personally?
That is such a good question. I have dedicated my career to mental health, given my training as a clinical psychologist. I don't believe it's possible for us to have whole health without mental health. And so it's been really important to me over my career to think about how we can improve access and high quality delivery of mental health care for young people.
That's great. I think a lot of people these days know that we are in like youth mental health crisis, so it's great to have people who work on these issues and are doing such new work like you are. The next question we want to ask you is, did you have a mentor or a professor who shaped your path? And if so, how did they influence your research or your career direction?
Absolutely. So I've had many, and we could probably spend the entire time outlining all those wonderful people who have contributed to my career, for whom I'm very grateful. But there's one person in particular who I think kind of set me on the path of being passionate about research as a way to better understand the world and help have social impact and make the world that we live in better. And that's an individual by the name of Dr. Doug Johnson. He was my undergraduate psychology honors thesis mentor. And I, believe it or not, did not come out of the womb knowing that I wanted to be a psychologist or implementation scientist. I was a little bit unsure. I went to college thinking I'd be an English major. The university I went to, Colgate University, had a required science STEM course to graduate. And so I took psychology, and the rest is history. And the reason Doug was so pivotal in my experience is that he literally hand walked me through the scientific process as I was doing my undergraduate thesis, which was on formation of false memories. I did a lot of more cognitive psychology work in undergrad, and he sat next to me and helped me formulate hypotheses and run the analysis. And I just was so enamored with the process of, asking scientific questions, doing the method. And it was really fun. This past year, I got to visit Colgate and give a seminar for the psychology department and spend some time with him. So he's been a real impact on my career.
That sounds amazing. He sounds like a great mentor, and I'm sure it was probably very important to your path and your work in general. The next question we want to get into is a little more into your work. What is implementation science, and why is it such an important and also relatively new field in mental health?
Yeah. So we spend a lot of money, billions of dollars as a society, engaging in scientific discovery. And that's really important because that's how we end up with all the great breakthroughs that we have as a society. But and we spend far less attention to getting those discoveries pushed out to all of our communities to make sure that everyone can access them and have high quality care. And there's a great example from a paper that came out in 2020 by Paul Thiel and colleagues in Health Affairs. And this was before the COVID-19 vaccine emergency use authorization. It was a simulation study. And what it showed was that the set of implementation factors would be more important for the effectiveness of the vaccine compared to the kind of biological efficacy factors. And that's really interesting because we spend a lot of time thinking about how to perfect the efficacy of our various approaches, but we don't spend as much time thinking about how we then implement. And so in the past 20 years, there's been a real push towards the development of this discipline called implementation science, which has really kind of come of age, in my opinion. 2006 was when the journal was founded, Implementation Science. I serve as the deputy editor in chief for that journal, which I'm very proud of. And in 2007, we had our first conference that NIH sponsored. And there were like 80 people there. And now there are thousands of people who go to that conference. Fundamentally, implementation science is about closing gaps between what we know we should be doing and what we're actually doing in the delivery of services broadly. Almost all of my work focuses on healthcare or mental health care. And we're kind of like detectives. We go into a context, we understand what might make it hard or easy to implement the best practice. We devise a roadmap and a plan to help people and places do the things that we're asking them to. And then we apply the scientific method to understand if our approach worked, iterate, and sustain. So hopefully that gives you a sense of what it's about. It's all about helping people and places do things that are going to result in better care for patients.
Thank you so much. That's a great explanation. And I think it is a new field, especially for a lot of young people. So it's great to hear about all the different directions that research can go. Next, we want to ask you, we know you've published over 300 papers. So what is one project related to youth mental health that you've been the most excited about?
Well, thanks for that question. I've been fortunate to collaborate and lead a number of different projects over the course of my career. But if you want to know the project that I'm the most proud of, it really reflects the work of a community of people over the past decade, and is the work related to secure firearm storage as a prevention strategy at the population kind of health level for suicide prevention and unintentional injury prevention.
That sounds great. If you had the power to implement one evidence-based intervention for youth nationwide, what would it be and why?
Well, that's a really hard question because there's a lot of things that I would want to implement. Fundamentally, it would be my dream if we could make evidence-based, high-quality mental health care, both from a prevention perspective and an intervention perspective, when people need higher levels of care kind of embedded within the settings in which young people spend their time, so that we could reduce the stigma and make it available to everyone. Everyone can benefit from focusing on mental health prevention. And then sometimes we need extra support, and everyone should have access to that. But going back to the question you just asked me, just relevant to the work that we've been doing, we've spent about a decade trying to learn how best to support pediatricians in primary care clinics to support parents and families in secure storage for their firearms to reduce suicide and unintentional injury. Many homes in the United States have firearms, and there's a lot of opportunity to support families in moving towards more secure storage options, which is really important when we think about suicide prevention. And we were able to show in our trial that we were able to support pediatricians from kind of rarely implementing our program to implementing it in almost 50% of the well child visits, which is when kids go to see their doctors annually for to get a checkup. It's my dream to do a study or an implementation initiative where we implement this nationally. So far, we've done it in 2 health systems in Michigan and Colorado, Henry Ford Health in Kaiser Permanente, Colorado. We have 2 new studies where we'll be expanding that work in Illinois in safety net clinics or federally qualified health centers, and also to women's health and adults primary care. But my big dream would be to do that study and implement a brief secure firearm storage program at scale nationally. And I think the time is ripe, given that firearm injury is the leading cause of death for young people in the US, many of which are suicide.
That sounds incredible. It seems like your trial has already had like a success in the places where you have implemented it, so it would be amazing if you could reach your dream and implement it nationally. Next, we wanted to ask you, what trends in youth mental health research are you most optimistic about over the next decade?
I'm really excited about work that aims to develop and test interventions or prevention programs in the context in which they're meant to be delivered, reaching young people when they are looking for services. I have a colleague, Dr. Jessica Schleider, who's been doing some really exciting work on single session interventions, which are intended to be accessed and reached at the moment that a young person is in need of support, and is a very nice complement to some of our more traditional models of intervention. But the more that we can kind of embed mental health care within the context of where young people spend their time and make it what people have access to, the better. I think having this kind of separate care model where people have to go seek out services, it often takes too long for people to get help when they need help, and just normalizing it as part of everyday experience, I think, is the future.
I totally agree with what you said about how sometimes it's separated to go get care, and that would be amazing if we could implement it into places where youth can easily access it. You often collaborate with policymakers and health system leaders. So, what can be done to ensure youth mental health remains a priority, especially at policy levels?
Yeah, well, I mean, one of the things that happened in the COVID-19 pandemic is that everybody realized that mental health was a priority for our country. Globally, it was recognized that that was a priority given the struggles that people experience and the spotlight that COVID-19 shone on those struggles. I'm very hopeful that we won't lose sight of that and that we are able to get traction on this vision about making mental health just a part of general health and making it easy for people to access high quality care. I think the way that we do that is by advocating and using our voices and not allowing stigma to get in the way to say that mental health matters and that every single person and family in this country are impacted by mental health needs. I think using our voices, our lived experience, our stories, as well as the data that we have available to us from all the great science that's been done thus far to make the case that we have programs that work. We can implement them and make them available to people. And we also need to study new ways to make sure we can reach all communities is what we need to do to partner with policymakers to make change.
That sounds incredible. People like you definitely are making such a big difference in this field, especially with your research and encouragement to young people to advocate and just tell their stories and use their voices. So we're very grateful for that. Unfortunately, we know that there have been some cuts in federal research funding. So, how can organizations like AIM help fill that gap and accelerate solutions that reach youth faster?
Yeah. So AIM is already doing this, but I'd love to see them grow their ability to fund early career scientists who are dedicating their work to youth mental health. There's a real need right now to support our early career folks who are mission driven in youth mental health and an opportunity for AIM to step in and to secure the future of the field and the future of our young people.
That sounds amazing. We wanted to end with some advice that you have for people watching this or any young people. What advice do you have for any students or young people, whether they want to pursue a career in mental health research or just be strong advocates for change in their communities?
What I hope for each person is that they find their why and they use that as fuel to change the world. And world changing doesn't take huge, massive movements. It takes each person making changes in their lives and advocating for the things they care about for those huge transformational moments. So for me, just linking back to the question that you asked earlier, I realized in college that I was fascinated by human behavior and that I had a mentor who supported me and helped me learn how to use the scientific method. And I think about how I use science every day and all the different things that I do and the decisions that I make to make evidence-based choices for myself as a human and in my day job as I do my work. And so I hope that for everyone that they can find their passion and their why. It's going to look different for each of us. It's unique to us. And to have that be the fuel of how you spend your time and try to change the world.
That's very inspirational. I think for everyone watching this, it's great advice. I think a lot of times when we think of change, we probably think that we're too young to do it or it's too much work or it's such a big task. But I think what you said makes sense that if we all come together and each of us do our part, it'll be much easier and much more attainable. With that, I want to thank you so much for being here. It was great to get to know you and your work, and we are so excited to see all that you do in your work and continue to see how successful you are in making changes.
Thank you. And thank you for the great questions. You've been incredible and you are the future.